Welcome to the voices of transparency and excellence. We're not pivoting, the world is spinning like a top. Let's stop, figure things out, get some answers. Come with us on this ride. Warm regards, Rick and Judi.
Welcome to our podcast series where we address crucial topics impacting our campus and community. I'm Judi Brown Clarke. My co-host Rick Gatteau is out on assignment today. In today's episode, we will talk about health and vaccines. We are joined here and so fortunate to have Dr. Jedan Phillips, a general practitioner in Renaissance School of Medicine at Stony Brook University. Jedan, thank you for joining us.
Oh, thank you for having me. I'm excited to be part of the conversation.
So let's just start off with you're a clinical professor in the Department of Family, Population, and Preventative Medicine. Half your time is teaching in the medical school. You're also doing your clinical practice. Can you tell us a little bit about what that looks like and how do you balance it?
Well, it isn't easy. I think one of the things going into the field of medicine is the importance of time management. And what I have found is that my work in the academic space also fuels my work in the clinical space. So they actually support one another, which doesn't make it too challenging of a thing to do just from an energy standpoint, because I feel that I tell people all the time, the real lifeblood for me in my practice is the connection with patients. I think that gives you the energy and the inspiration. And then the other aspect of teaching, one of the things I've always felt is, how do we influence what's going to be happening in the medical field? And I think the best place to be is upstream. And upstream means, in this case, teaching our medical students, because, again, the world that they are going to be entering into is a lot different when I graduated in 1995.
It's interesting. When you think about preventative care, tell us a little bit about your philosophy, some of the strategies that you use, and do patients listen to you?
Well, firstly, you look at the top conditions that are taking our people away in this country. You got heart disease, you got diabetes, you've got screenable cancers. I know in my own particular family, diabetes and heart disease especially. And those are conditions that you can walk around. I was at a talk recently that I was providing, and I said, how many of us in the room would go to work if we had a headache? Everybody in the room raised their hand. How many of us would go to work if we were tired? Now, if they knew that headache was equivalent to a blood pressure of 200 over 100, or my sugar was 300, and that's why I was fatigued, would they still be, the same way? But I think many of us have a very reactive approach to our life. And our life, I think the only things that we're not reactive with is like getting our oil changes for our car in a timely fashion, but do we go get physicals annually? Yeah. Do we go pursue just checkups when we're feeling fine? And I think that's the important part, because the prevention costs you a whole lot less than reaction. I have a patient who I'm setting up for a hip replacement, hasn't been in the office for quite some time, hasn't had any of things like blood pressure, other things checked. So as we're setting up, scheduling the hip replacement, we've got to now first clean up these other issues. Yes. So, unfortunately, it is something that can have ramifications outside of just the direct medical issue. And I think one of the things that I try to do is connect the dots to the patient. And when the patient see, wow, I didn't realize that me not getting my physical exam could have an impact in these other places, or me not having that preventive information could impact me, I think they begin to understand how easy it is. And then, unfortunately, when they have a reactionary medical situation, I'm not a I told you so person, but I point out, see, this could have been a little easier. Yes. And in my house growing up, I remember my parents, hear my father screaming, that meant things were about to happen.
Yes.
I think many of us, like when we look at our physical health, if we're not feeling bad, we assume that everything is good. And unfortunately, that's the taken for granted of this vessel that is our bodies. And I think it's important for us to go get those numbers, because, again, maybe the cholesterol is not dangerously high, but it's a little bit high. And I know another thing that people always say to me is, I don't want to take any medicines, Dr. Phillips, if I can avoid it. I want to give your lifestyle the opportunity to answer that question for you. And the best way to do that is to be preemptive, and that's getting your physical exams. The other thing that's very important, I just had a female patient before I came over here today, and she hadn't had a pap smear in 20 years. And I said to her, I says, hey, imagine if you and I were driving to Philadelphia or something like that, and you see my oil light come on, and you say, hey, man, when did you get your oil changed last? And I tell you I haven't had my oil changed in the car in 10 years, you're going to be looking at me like I'm crazy.
Right.
Same thing, your body's looking at you like you're crazy when you haven't done these types of preventive things, because the purpose of these preventive tests, for example, like a pap smear, is to catch, if there is something, to catch it earlier, and earlier is a lot less complicated of a management or a treatment than if we wait till things have really, hit the fan.
And it's interesting. So I think sometimes we make so many things a priority and not ourselves. Or we're so standing in fear that the fear becomes a reality because we could have done something preventative versus something that becomes, actually secondary or tertiary because it's manifested into something that now has to be managed.
And I think what you said, the term fear is very critical. I know for myself, I had bilateral hip replacements. Another thing about me is my oldest son passed from bone cancer when he was 17 years old. So I'll be quite honest. I was afraid to get my hips checked out because I was afraid that they might tell me I had bone cancer. So I was walking around probably in a space where I should have been doing something, but I was in that space because I was afraid. And for someone who's in the position of telling people to be brave, I says, I've got to do better if I expect better out of the patients that I'm trying to take care of. So it can happen to anybody, and it's a very, very real thing, that fear of the unknown.
And I appreciate you sharing that, because I think that vulnerability that you just shared gives permission to our listeners that may be apprehensive about getting a particular test or having a scan or so on, because it may be in their family, or it may be something that they know something's wrong, but in the ignorance, I can deny it. But once you confirm it, then it's real. And it's real in the ignorance.
Absolutely. And I think to take that a step further, when you look at screening tests, like men think of getting their prostate screened or, getting a colonoscopy, there's these stigmas that they attach to it to give them a reason to say, no, I'm not going to do that.
Yeah.
And again, my job as a primary care physician is to address those fears, to answer any questions that those fears may have, and to try to allay those fears so that the individual can continue to move on appropriately.
And so nutrition, and there's a lot of real great theory around food as medicine. And so when we talk about nutrition, you can't go on the internet or you can't pick up a book, you can't look at anything, and there's not some kind of fad diet. Or there's some testimony of some person that's in esteem that has, eaten a certain way and had some kind of positive outcomes. So how do our listeners know, as it relates to nutrition, like what should one be doing?
Well, I think, the first thing is I use resources like the United States Preventive Task Force. I use the American Academy of Family Practitioners. I use the American Heart Association for recommendations that I present to my patients as far as things like meat, butter, and cheese, which I've heard recently that, we should increase the amount. And I use these bodies that I've used and have demonstrated, reliability over the years, and they still maintain that those food groups should be included at a very low rate in a person's overall diet. I think the other thing that I try to do with not only diet, but other health information that people get online is, number one, it's opening up, making a person feel like I can ask my doctor.
Yes.
I think I try to always identify myself as a resource for them so that they don't feel like they got to rely just on doctor or social media, TikTok, Facebook, etc. And I'm not saying those spaces don't have accurate information, but I do think, as they say now, the new due diligence, we have to do our due diligence to ensure the accuracy of this information. Even when you want to use some of these AI, vehicles, you just got to make sure that the information is accurate information, because yes, it can give you a bunch of recommendations, but if it's not accurate and it's not appropriate, it may not be helpful. I listen. So I think, one of the things that can happen, especially if somebody's got some epiphany, hey, I read this, they want to be heard. They don't want to be minimized. Yeah. So I hear what their point is, and I try to, if it's something that requires me to debate or present something to the contrary, I try to present facts. And one of the big things for me is a concept we use is called health literacy. Yes. And basically it's the communication of health information in a way that is understanding or comprehensive to our patients. And again, taking into consideration the average reading level in the United States is like between 6th and 8th grade. So taking that into consideration, it's important to make sure that we deliver our messages, whether it's verbal or written, in a way that we know that our patients are going to take it in. And then the other thing is, do you ensure that they understand what you meant? Hey, Dr. Brown Clarke, when you get home to your husband and he asks you, what did the doctor say today? Tell me what you're going to tell him. So I can then see, is there some comprehension issues that we might have based on what your understanding of our conversation was. So I think that when patients feel that you're a resource for them and they can come and talk to you and you're not going to bite their head off if they say something, hey, I read this online, what do you think? The last thing I think you need to do is like, whoa, what are you talking about? Because I think that can make people feel like, wow, I was just trying to educate myself. Yes. And these are the resources. I mean, when we were younger, we had Britannica and we had all of these other vehicles that we would get information from. Now it's in your phone. Yes. And whether I'm old school or not, I got to respect the new school or what's happening today. And I've got to be able to function in that space.
All right. So one of the things I find, and I don't think I can look on social media or really, quite frankly, watch television over a certain length of time, and I'm going to see some ad that talks about the GLP-1, the ability to get a shortcut to losing weight. I mean, can you just talk a little bit about the philosophy of shortcuts, because these should be lifestyles? And second of all, it does work.
Yes, it does work. And the purpose of it is to help a diabetic patient who weight may be an issue, and losing weight can be something that can get that person moving in the right direction. Or if you have somebody who's overweight and they have obstructive sleep apnea, yes, a condition that heavier you are, the more problematic the condition can be, losing that weight can be helpful. Or if you've got a liver condition like fatty liver, or if you've had bariatric, which is weight loss surgery, those are scenarios where these medications have been approved to be used. And I have no problem with that. I tell my patients, I can remember my mother had a Volkswagen Bug when we were younger, and sometimes it wouldn't start, and sometimes we had to jump start the car. With individuals that are dealing with the conditions that I've just mentioned, they need a jump start. However, like many people say to me, I don't want to take medicine forever. So to make those medications work their best, we also have to simultaneously be working on healthy diet choices. In addition to that, developing some exercise strategies as well. The frustrating thing for me is when you see these advertisements or it being mentioned, it is not really being mentioned with any of those medical scenarios. I'm more so seeing it as a tool for people to lose weight. And I feel that shortcuts is something easily gained is easily lost. And I've seen people, once something happens, because with these medications, insurance companies want you to check in periodically. So you got to get an A1C done if you're a diabetic. And if that A1C is improved dramatically and your weight is improved, now you got to come off the medicine. And unfortunately, if you're not prepared with lifestyle, implementations to happen, I see the weight being gained right back. Yeah. And I can only imagine how frustrating that must be for an individual. But as we know, anything that comes quickly can go quickly as well. So what do we do to fortify it? And I think those lifestyle, interventions, starting to eat a healthy diet. One of the things you have heard is people losing all this weight. Now it doesn't look right. Yeah. Now it don't look right, which is another. But that speaks to, are you still taking protein or how you're eating as you are on these medications to make sure that the weight loss doesn't look like a person who's starving?
When we think, and let's stay in kind of the clinical side for a moment, then we'll move over to the education and the administration side. What's like one of the more common questions that patients ask you?
What do I need to do to stay healthy?
Yeah.
I think that's probably the basic general question that they ask. And, based on the individuals, there's different things that an individual may be dealing with. Maybe their issue is, I need to work on my weight. Maybe it is, I just need to be more disciplined with whatever the intervention is, whether it's me eating a certain diet, whether it's me taking my medications. I think that, many people want to be healthy, but the idea of it and the reality of it as it fits into your life, sometimes people need some help. How do I eat healthy if I take the subway to work and I have a 12-hour workday, and the only food is the food truck outside? What are the strategies that I could have? I have one patient who works in the city, and, we talked about food prep, and now he came in, he's like, I put my whole weeks together, meals together, so I'm actually doing much better. And then, as you watch these individuals start to make these changes, it's sort of like seeing somebody get in shape. Yeah. And then you say, you see how easy you ran that last mile, man. Yeah. You're getting in shape. Again, when their blood work comes in and I see the cholesterol is a good number, or the A1C, which is the score that we use to check on diabetes, has improved, or their weight or body mass index has gotten better. I think the other thing that we have, or I have as a general practitioner, is you have the power to affirm them, and I think that is incredibly important, because I think people are very vulnerable with their health, and it's a space of incredible transparency. And if you've got a person like, hey, you're Dr. Phillips, you're this big, tall, strong guy, but again, I'm scared to say, hey, could you help me? Because I just had both my hips replaced. I can't bend over and grab my shoelaces. Yeah. Or, I have a condition that may require me every 3 months until I get it into a better place that I have to go get a blood test done. Yeah. The doctor, I think, has a role not only to prescribe, but also to be that cheerleader, to be that motivational speaker for them. So I think it's incredibly important, especially when you're giving news to somebody, to really recognize like how I deliver this can really impact how this person comes out of this situation.
The authentic practitioners, what are some of the things that you do?
Well, I think, just in the one-on-one sense, I think taking the responsibility as you're a model to these students. So I take pride in that, when I'm operating or doing my thing, as they say, in front of them, I don't let things like I'm tired or whatever get in the way, because I feel that if I make it easy to put my wrong foot forward, then they're going to think that's okay. And as a person who is seen from a patient standpoint, not always receiving compassion and empathy, I think it's important to model that. I think the other thing that at Renaissance that we try to do is we have coursework.
Yes.
You know, we have a course in particular, Medicine in Contemporary Society, which is a first-year medical student course, and it touches on, you know, a lot of basic issues, research, taking care of the elderly, but within those topics that we discuss, we talk about compassion, we talk about empathy, we talk about social determinants of health, we talk about healthcare disparities, and again, making individuals not only aware of, hey, you need to be caring, but I think giving them models on how to be that way. But the other thing is making them aware of circumstances, even if they're not your own circumstances. Because I think for me, because I've experienced, you know, situations where I was not treated as well, or I was the only, or I had barriers to get to where I needed to get to, I am a little more naturally in that space of empathy and compassion. But if you haven't had those experiences, that's not a fault of your own. And I think it's incumbent upon us as an educational system, how can we put you in spaces of learning that can help you recognize the power and importance of empathy, the power and importance of being compassionate. So I think that course has really been great because we have faculty discussions before we go in. And at the faculty discussions, we hash out our own feelings because many of us, as I mentioned, are older. We went to medical school at a time when these type of things were not a priority.
Yeah.
You know, you could go through medical school and be not a compassionate person or empathetic person and still be, quote unquote, a great doctor. But we see in today's age with not only just the challenges that people see on a daily basis, just the significance of mental health.
Right.
You know, mental health is such a big thing. And I don't feel if you don't recognize that and you're not aware of that as you communicate with people, you don't recognize that you could turn them off. And people are at a time where they will, as they say, cut their nose off to spite their face. Hey, I went to Dr. Phillips' office and he didn't even look at me the whole time. You know what? That's why I don't go to doctors.
Yeah.
What if this person has a medical issue that doesn't care whether Dr. Phillips or whomever is respectful or not, and that issue needs to be addressed? And I don't want to push somebody away in that capacity. So not only do I make sure I practice it in my practice, but I do feel in my role as faculty, in my role as a preceptor for medical students, that those are the type of educational points that I bring up just as much as I'll bring up like, hey, you know, with that pneumonia, we should have used this antibiotic or this would have been the most appropriate test.
The other piece that, as you were kind of alluding to, is like you're out in the community. We talked a little bit, or you just touched on like the social determinants of health, the social drivers of health, those impacts that really are, and sometimes it's environmental, sometimes it's access to care, sometimes it's just quality of food. It could be water quality. It could be, you just think of coastal erosion and all the things that happen like after a flood. We have the northern forest fires and we start to get impacts of the smoke. And so you look at air quality. So when you think about, you know, really impacting communities that are underserved, talk a little bit about the home clinic.
Well, Stony Brook Home stands for Health Outreach Medical Education. In 2006, and this is one of the things I really enjoy about Renaissance, is it's a administration that is very receptive to the students. So with that being said, and around that time, we were seeing issues pertaining to uninsured, undocumented individuals, and we were seeing things happening. And the students came to me because that was always, the outreach thing was always something that I was passionate about. And they said, hey, we have this idea. We'd like to see if you would help us with it. The idea was to develop a clinic where we could provide some type of medical service that will allow us as students to provide that service, but more importantly, allow the students to really understand how do you operate in an area of where people don't have, because this may not be where they practice at Stony Brook Home after they finish, but they may be in other areas of the country, and you want them to have a rubric or a basic mantra that takes those things into consideration, because I think one of the big things, especially when you're talking about helping a community, is when I come to you with a solution that doesn't really touch on the solutions or resources that you have in a particular community, that community is looking at you like, okay, whatever, because they don't really feel that this person or this entity doesn't really understand us. And I think as a provider, for me as a general practitioner, one of the things that I feel is I have to be aware of the issues that involve the community where I'm serving, because if I'm aware of those issues, I can come up with plans that take those things into consideration. And I think in recent years, we've also recognized the power that we have in medicine. So I can extend some political influence possibly, or help with organizing or making statements like, yes, we do need better food resources, or we do need to have a health clinic in this area that provides people. So I think the Stony Brook Home Clinic gave students an opportunity to augment their educational experience with these other lessons that we know are very, very important. And I think this year, upcoming 26, we're going to be on 20 years of an existence. And it's been, I've been blessed to be involved with it from the very beginning. I have stayed in contact with students, and I have students that constantly reach out and they talk about how that experience really, of course, their education gave them the tools, but they really feel that experience put them in spaces that wherever they're at, they're able to provide the best compassionate and empathetic care that's needed.
And I love that, because when we talk about translational learning, it's like in the classroom, yes, it's theory, it's data, it's evidence, but to actually in practice, to go to a community that you've never been in before, with individuals you may not have interacted with before, and seeing people that are navigating things that maybe in your truth, you would just easily go to a pharmacy, or you would go to the doctor because you have insurance, or this type of illness does not run in your family. So your ability to be, to stand in somebody else's reality, I think just makes an incredibly more compassionate, thoughtful, empathetic, non-judgmental care provider, no matter where you're going, because this will be a part of your patient population.
I definitely am thankful.
Yes.
And as I said a few moments ago, for me, I had life experiences that made that type of development sort of organic for me. However, there are a lot of people who, to no fault of their own, have not had those experiences. Right. So that's why, again, our academic and educational opportunities, such as the Medicine and Contemporary Society, the volunteering at Stony Brook Home, just two examples of experiences that students can go through during their educational process so that they can educate themselves on how do I present myself as an empathetic provider. What are the type of questions that I need to have, even to the point of body language.
Yes.
Today I know in every patient room at our institution there's a computer. I personally, again, I'm not saying I don't use the computer, I do. However, I don't use the computer in the room. Because I know, for me, eye contact is a big thing. And I'm sure for many people, it's the same way. So for me, I like to look at them. I like to let them speak, because I think that's another thing. There's been medical research that has shown that doctors will interrupt you, I think sometimes as soon as 10 seconds.
Wow.
So if I was to interrupt you in 10 seconds and not let you get a word out, how confident you're going to feel like this is a space where I can get what I need to get and get the things I need to get taken care of. I think, again, it's important for us to have spaces education-wise where those priorities are shown to our students. And then you have individuals that can model it for them.
So we've talked a little bit about kind of, how we're and how are you are impacting your current patient population, kind of the community ecosystem around our patients, our new medical students and the experiences they're getting. So let's talk a little bit about a pipeline program that you're working on. And you have involvement with the Black Men in White Coats. It's a nationwide movement to encourage communities to support young Black men in high school and college to become physicians. And we know what it means. All the research shows when you see someone that looks like you and sounds like you and represents you and your truth and your experience, it means that you can be there too. You just have to find your pathway, but it's full affirmation. So can you tell us a little bit about Black Men in White Coats?
So Black Men in White Coats, as you said, it's a national organization started by a Black physician, male physician. He was the first, and he talked about, in being the first, how the challenges that he had. And again, many individuals that look like him had similar challenges. So this group was really started with that idea primarily. However, I think as it's grown, we see that unique, me being the first or me being the only in this space, you've got other immigrants, you've got people whose parents never went to college, you've got, people gender related, LGBT, all of these experiences have maybe not exactly the same challenges, but the challenges can be very similar. So I think, one of the things, not only with working with Black Men in White Coats, but my other pipeline activities is I feel as an institution, especially we are a flagship institution here in Long Island. I think one of the things is connecting with that idea that there are a whole lot of different people that have a very similar theme of I'm going to be the first, or I'm interested in going into medicine or healthcare, but I don't know anybody. Like my son he could come home and say, hey, Dad, what did you have to do when you had to take the MCAT? So whatever the questions may be, there are a lot of individuals that don't have that. And I know that when I was coming up, my parents didn't go away to college. I was the first doctor in my family. I didn't know it. Many doctors that looked like me. So I didn't really have places that I could always access when I had questions. So for me, what I am passionate about, as I said, is going upstream. The upstream means we have to try to at least plant the seed that this is a possible option if you're interested, because you just said a few moments ago, there's value to a healthcare team that is a diverse one, that come with people from all different backgrounds. And I think the pipeline activities, in addition to Black Men in White Coats, allows students that weren't sure, that didn't know how to go about expressing their interests, some idea of how they need to proceed, and helps them. And it creates a village of people that say, you know what, as opposed to me feeling embarrassed because I don't know any doctors or don't know who to ask or what the questions to ask, now I know there's 3 or 4 other students that are in a similar boat as me, so I don't feel as shy or as reluctant to put myself into spaces where I might be, taking those first steps into trying to acquiesce into becoming that healthcare provider.
So I can hear our audience in my head, and you can't have a doctor without getting some free advice. So we know we're coming into the cold weather season, and we have seasonal affect disorder. The days are darker, they're slower, they seem shorter. What are like 2, 3 key things we should do during this time to really keep a level of health during this winter season?
Well, I say the first thing is if you have health issues, stay on top of them.
Good.
So I think that's number one. Number two, again, I feel that it is very, very important to have a process. Yeah. That process includes meditation. That process may include exercise. That process includes nutrition. I think those things are incredibly important. with the weather changing, I know for myself, I'm a person that suffers from seasonal allergy symptoms, and they tend to flare up. I will definitely take my allergy medicines now, because those allergy symptoms are the things that can unfortunately trigger into, I got a cold, I've got a pneumonia, I got a bronchitis. More importantly, I've got to miss school, I got to miss work. And I think being proactive, especially with a condition like allergic rhinitis, is very, very important. The last thing, and I know this sometimes is very controversial, I'm a believer in, I got my flu shot, I got my COVID booster shot. I feel those preventive or prophylactic vaccinations can definitely make a difference. And again, if you don't want to do it, it's no fault or no problem with that. But I found for me, since I've been doing it, I've been able, and I'm up in the face of people all the time that may not be honest, like, hey, I'm sick, or hey, I got COVID or whatever, and they're right in my face. So I try to do what I can do to protect myself.
There's been a lot of controversy around vaccines, and certainly even our listeners probably may fall across that bell curve. So can you talk a little bit about your observation with your patient population, or what you may be hearing? Do you see an increase, or do you see a decrease in vaccination usage, or questioning inquiries about it?
I would say questions, definitely. I think we are in an age where people want to be informed of the why. Why do I need to take this? How does it work? So I think that is something that is very, very much in play now. And I think it's been in play ever since the pandemic, because of the questions and the controversy that people had. For me, I use my own testimony. I have children, and, I let people know what I'm doing with my own child. So, and I don't have a big population of parents that don't vaccinate their kids. So I don't know if I could speak as, accurately as some other providers that have maybe a bigger or more robust practice. And I do have quite a few young people that I take care of. So, maybe I'm explaining it to them where they feel it's something they would like to do. I have seen people that have chosen the route of not doing vaccinations, and then, some of the administrative, things that happen, kids being, left out of school, et cetera, those things can happen. But it's not a big population of patients that I'm seeing. I think in response to it, I'm just being more transparent and forthcoming with the explanations and the why part, because I think people desire to be more involved from an informational standpoint. So,
well, thank you, Dr. Jedan Phillips, for sharing your insight and expertise today. We hope our listeners find these discussions informative and empowering as we navigate these times together. Thank you again to our guests for your incredible, valuable contributions and all the work that you do. Join us again next week, where we'll continue the conversation as we did earlier on artificial intelligence in us. For now, I'm Judi Brown Clarke, and thank you for tuning in.